In my mind, surgery is a last resort. And so when I see somebody, they come in and I do not look at their x-rays before I see them. And I do that on purpose because I don't want to be biased by what the x-rays show. So when I see somebody, I go in and I ask them a bunch of questions. I examine them, then together with them, for the first time, I will look at their x-rays with them. And then I tell them, here's what I think you have, and here's every possible option I know of for dealing with it. And I always start with live with it. And I end with surgery. There are a few differences between hip and knee arthritis, but there are some similarities. First option is to live with it. And people can do that for a while, but after a while it gets pretty old, right? Second option are pills. And in general, the pill options, and everybody's different. So some people, for example, can take Tylenol, but not anti-inflammatories. And so this is where it's appropriate for somebody to come in and be seen so we can decide what's the safest thing for them to take. But in general, the pill options would be Tylenol. Anti-inflammatories like Advil or Aleve are two over-the-counter examples. Have you ever heard of that glucosamine stuff? Have you ever heard of it?
I think I was on glucosamine. It's an anti-inflammatory, right?
Well, no, we don't actually know exactly how it works, but it's typically glucosamine and chondroitin, and you get it over the counter. You don't need a prescription for that. It's controversial if it does anything, though. There are some really well-done studies that say it does nothing at all. There are some really well-done studies that say it might help the pain of arthritis. So arthritis, have you ever seen the end of a chicken bone?
Uh-huh.
You know how it's covered with that white stuff that covers the ends of the bones? We call the white stuff cartilage. Cartilage is a slippery, smooth stuff that covers the ends of bones so they move past one another so smoothly. All arthritis is when it wears away. That's all arthritis is when the cartilage wears away. There's over 100 causes of arthritis. But in all of them, the end result is the cartilage will wear away. And eventually it can wear away to the point there is none. And then you would have one bone rubbing on another bone. That hurts. And cartilage is made up of, one of the parts of cartilage are made up of building blocks of glucosamine and chondroitin. So we truly don't know why taking it by mouth may help or may not help. And the studies are all over the map if it does anything. The American Academy of Orthopedic Surgeons has a position statement saying it really doesn't do anything. But I think it's probably reasonable to try it because it helps dogs and horses. And dogs and horses don't have a placebo effect. So I think it's reasonable to try it. It will not regrow cartilage. So I know everything on the internet is true, right? Major eye roll. Despite what you read on the internet, nothing will regrow cartilage. Nothing will regrow cartilage. Then another pill option that people can try is turmeric. The spice turmeric, you can get turmeric pills, and they have an anti-inflammatory effect. Next option I talk about are shots. And there's three types of shots people may have heard of. One is a cortisone injection. Cortisone is the most powerful anti-inflammatory we know. And when you have arthritis causes inflammation. Inflammation hurts. So when we inject cortisone into typically a knee that has arthritis, it temporarily settles down the inflammation that's in the joint because of the arthritis, and that will temporarily make someone hurt less. It doesn't cure arthritis, but it's a way to temporarily make the joint hurt less. In the knee, there's another type of shot that's essentially a concentrated form of the knee's own lubricant. And the problem is it's a little controversial if it does a lot. It won't do anything once someone is bone on x-ray. And then the third type of shot people may have heard or read about are stem cells. And we all really, really want that to work, but right now there's no data that it does. And it's really frustrating because we really all want it to work, but there has never been a single proven case of injecting stem cells into a bone-on-bone joint and having it regrow cartilage. So that one I would be a little skeptical about right now. In the knee joint, there is a brace that we can sometimes use for knee arthritis, depending on the location of the arthritis. There really isn't a great brace for the hip. People can use a cane, and typically it's in the opposite hand. So, for example, if somebody's right knee or right hip are have arthritis, we'd usually recommend that they use a cane in the left hand and put weight on the cane when they put weight on the leg that has arthritis. Some people try these creams you get over the counter that have hot pepper stuff in them. I think Ben Gay was one of the original ones, decades ago. And there's a whole bunch of them on the market now, and they all have capsaicin in them, which is the stuff that makes hot peppers hot. And the way those work, you rub it on the skin around whatever joint is hurting, and it makes the skin feel like it's burning. In some people, that will then trick your brain into not noticing the deeper arthritis pain. It's a distractant. I know it sounds funny, but there's actually some science behind that. I always tell people if you're going to use it, put it on and immediately wash your hands, because if you put it on and accidentally rub your eye, it's going to be a bad day. Another option is physical therapy, and physical therapy potentially can help 4 different ways. First, they can sometimes crank on whatever joint is arthritic to help get more motion in it. Second, it gets people strengthening their muscles, and the stronger the muscles are, the better they protect whatever joint they're working on. Third, it gets people exercising. And when human beings exercise, we can get an endorphin release. Have you heard of endorphins? It's essentially the brain's natural morphine. And in all of us, when we exercise, our bodies make endorphins, which make you hurt less. Now, the problem in the world of hip and knee arthritis is if you have arthritis, it's kind of hard to walk for exercise. So our first, second, and third choice is swimming. You're not going to damage a hip or a knee by swimming because it takes away gravity. Probably second choice is stationary bike, and we like a stationary bike because it's hard to get hit by a car on a stationary bike. Third choice is elliptical, because even with walking, there's still some pounding with walking, and elliptical takes that away. And then the fourth thing that physical therapy or exercising does, it helps people burn calories, which can help them lose weight, which puts less stress on the hip or the knee. And the hard part with that is, I don't know an easy way to lose weight. And one of the things that I tell my patients, true story, that at the end of August of 1999, my 39-year-old brother died from the complications of being overweight. I don't know an easy way to lose weight. And it's so frustrating because every pound you or I carry, whether it's in our arms in a box or in our body, every 1 pound puts 4 pounds of stress on the knee joint and 6 pounds of stress on the hip joint. So imagine if somebody lost 25 pounds, that would be 100 less pounds of stress on the knee joint and 150 less pounds of stress on the hip joint. That's a big deal. That's a really big deal. It's just hard because whoever figures out an easy way to lose weight will be the richest person in the world in about a week, maybe less. And then in general, then the last option is surgery. And depending on the joint, we can do a partial knee replacement, a total knee replacement, or if it's a hip replacement. But in general, so that's being very general because different situations can potentially have different options. But in general, those are the options for dealing with hip and knee arthritis.